The number one myth is interlocking nailing of humerus will severely impair the shoulder function due to rotator cuff damage. The reality is, with proper technique and entry point, the rotator cuff damage can be minimized and shoulder function can be preserved. So the myth number two is there is always chance of radial nerve injury, as it is a complication for the interlocking nailing of humerus. And it is not a complication for the open reduction and internal fixation for plating. So it is, yes, it is, there is risk of radial nerve injury when the fracture is at the spiral groove. There is chance of the radial nerve injury, but in the rest of the part, if the fracture is in the rest of the part of the humerus, there is minimum chance of the radial nerve injury when the instruments like the guide wire, reamer, and the nail is introduced after proper reduction of the fracture in the distal fragment. Both AP and lateral view, the fracture is reduced properly. Only then these instruments are introduced inside the distal fragment, and don't allow your instrument to wander inside the soft tissue. So these are the two myths which is associated with interlocking nailing of humerus, and other two controversies, whether which position of the patient should be used for the interlocking nailing of humerus. There are three positions. Number one, supine position. When it is used, it is comfortable for the anesthesia point of view as well as the surgeons. But the distal locking, which is done by freehand technique, is slightly difficult and tricky because the anterior surface of the distal part of the humerus is triangular. So finding the entry point for the distal locking is slightly difficult because slipping of the drill bit or KY. So it should be at angle, it should be introduced at angle, and then it should be kept in a straight line. So this is the disadvantage of supine position, and in lateral position as well as the prone position, the distal locking is done from the posterior surface, which is flat. So the entry hole, finding the entry point for the distal locking is easy because the surface is the flat, but it is uncomfortable position for anesthesia point of view, and the surgeons, it depends on the surgeon's choice. So I do use supine position for all my interlocking nailing. Number three controversy is because it is non-weight bearing bone. So one screw distal and one screw proximal is sufficient. But I use 2 screw distal and 2 screw proximal because the 2 is always better than 1. Always stronger than 1. If it is just like the 2 kidney present in human body, if one fails, other start working. So, and 2 engines in the aeroplane, one engine fails, the other start working automatically. So, if one screw is not working, then the other screw will do its work. So, the fixation is better by 2 screw proximal and 2 screw distal. So, friends, these are the advantages of interlocking nailing over the plating of the humerus, and these are the myths, and these are the controversies, whether 2 screws should be put proximal as well as the distal, what position should be used in this talk, and let us get tuned for the next video and subscribe my channel for more update on orthopedic surgery and insight.